Hello students, let us study about peptic ulcer part 2 pharmacology. Previous part हमने end किया था with the diagram showing various mechanism of action. अभी we will focus more on types of peptic ulcers, and in pharmacology we will see various classification and what are the basic GPAT points which you need to remember हर एक class of compound के लिए. So let us start. सबसे पहले है acute peptic ulcers, which are also called as stress ulcers. Coming to the etiology, it could be infective, that is because of a particular infection, या तो it could be because of other than infection. So in infection, the two main bacteria जो involve होते हैं infective पेप्टिक अल्सर्स के लिए दे आर सैल्मोनेला और स्टेफाइलोकोकस एंड ये मेनली फूड पॉइजनिंग के टाइम पे होता है. सो यहाँ पे आपका एक जीपैट पॉइंट मिलता है आपको, दैट इज इट कैन बी बिकॉज ऑफ सैल्मोनेला और इट कुड बी बिकॉज ऑफ स्टेफाइलोकोकस. देन इट कुड बी नॉन इन्फेक्टिव, ड्रग्स की वजह से सर्टेन ड्रग्स कॉज पेप्टिक अल्सर. NSAIDs cause peptic ulcers, non-steroidal आपके डाइक्लोफेनाक, पैरासीटामोल. साइटोटॉक्सिक ड्रग्स एंड कॉर्टिसोन आपके एंटी कैंसर ड्रग्स. देन अल्कोहलिज्म, सिगरेट स्मोकिंग एंड सिवियर स्ट्रेस, दैट इज सिवियर स्ट्रेस इन द सेंस लाइफस्टाइल इंड्यूस्ड स्ट्रेस. सो ये सारे पॉइंट्स आर देयर इन acute peptic ulcers. The site of ulcer is very important and could be a part of GPAT MCQ, where at which site the acute peptic ulcer is involved. It is stomach and first part of the duodenum. Pathologically, that is in case of आपके जो scans होते हैं various types of endoscopy, उसमें the pathological factor classical जो marker रहता है कि whether it is acute type of ulcer या chronic is hemorrhagic inflammation, that is certain blood is seen और inflammation होता है with superficial ulceration, मतलब deep tissue involvement नहीं होता है इसमें. Fate, that is ये खत्म कैसे होता है, is usually by healing and regeneration. नेक्स्ट हम आते हैं क्रॉनिक पेप्टिक अल्सर में. यहाँ पे द साइट इज ऑफ वेरिएशन एज इन द ड्यूडेनम जो हमने पहले देखा था वो तो है ही, प्लस स्टमक में भी टुवर्ड्स अ लेसर कर्वेचर सिंस लेस इज द एरिया, वहां पे लेस कर्व है जिसकी वजह से एसिड इन्वॉल्वमेंट ज्यादा हो सकता है, इसीलिए लेसर कर्वेचर. Then margins of the gastroenterostomy. Gastroenterostomy is when जो gastric bypass करवाते हैं where the stomach is cut and then ligated. So the margins of the ligated portion, joint portion जो रहता है during the surgery, उस जगह पे भी chronic type of peptic ulcer हो सकता है. Then in the duodenum, stomach or jejunum in patients with Zollinger-Ellison syndrome. Then it could be with Meckel's diverticulum that contains ectopic gastric mucosa. Ectopic gastric mucosa का मतलब होता है overgrown gastric mucosa. जब ज़्यादा mucosal cells रहेगी तो ज़्यादा pepsin release होगा, and because of which there could be chronic peptic ulcer. Etiology is genetic factor. Genetic factor plays a very important role in peptic ulcer, जहाँ पे 20 to 50% of the duodenal ulcer patient are family positive in nature. So the biggest factor that could be involved in peptic ulcer is, and that too chronic peptic ulcer, is genetic factors. Next we come to the hormonal factor, evident in case of Zollinger-Ellison syndrome. The hormone आपको जो याद रखना है which is involved in peptic ulcer is gastrin hormone. The gastrin hormone is the hormone which is involved in Zollinger-Ellison syndrome, जहाँ पे इसका upregulation होने लगता है, and it is classical one involved in gastric ulcer. Then we have the environmental factors like cigarette smoking, coffee, and alcoholism. They are all acidic in nature and they increase the rebound reflux and acid production. Emotional stress, which is very evident in case of duodenal ulcer. Then the diseases that are associated with ulcer are chronic bronchitis, emphysema, liver cirrhosis, and renal failure. You have to remember the names of all of these. The pathogenesis in case of duodenal ulcer is due to increased gastric secretion plus rapid emptying of the stomach into duodenum. Duodenum is a part of intestine. So when a highly acidic juice जब आपके duodenum में rapidly enter होते हैं, it causes a very large amount of acid influx into the intestine. And since duodenal is the first part of the intestine, the duodenal ulcer is because of rapid emptying into the duodenum. यहाँ पे आपको pathogenesis पता होना चाहिए. The reason because if it is duodenal ulcer, तो उसका pathogenesis जब आपको पता है तो accordingly that class of drug you will give. अब यहाँ पे rapid emptying of the stomach, so you will give something that reduces the rapid emptying of the stomach. So selection of the drug is as per its pathogenesis. इसके लिए pathogenesis पढ़ना is important. Then cause is because of increased vagus nerve stimulation. Vagus nerve again the gastrin hormone को वो increase करता है. Increased number of parietal cells. Parietal cells में there are gastrin receptors which are present. So increased number of parietal cells also cause this. Then increased hormonal stimulation, that is Zollinger-Ellison syndrome, जहाँ पे gastrinoma होता है, which is a cancer of the gastrin gland, which increases the number of gastrin cells, which causes more of gastrin release, accordingly more of acidity. Increase the responsiveness to the parietal cells to the secretory stimuli. What is secretory stimuli? They are pepsin, there are food. Okay, so the sensitivity of parietal cell increases. That previously थोड़ा stimulate करने पर it was not releasing the acid, but now थोड़ा stimulate करने पर भी ये बहुत ज़्यादा acid release कर रहा है. So there is increase in responsiveness of the parietal cell, जिसकी वजह से it increases the acid secretion. Then increase psychostomatic stimuli. Second is the gastric ulcer. हमने duodenum में देखा, अब exactly gastrin का part, that is towards the stomach, ये कैसे होता है? It is due to the decreased mucosal defense और increased damaging forces. आप फिगर ए देखेंगे तो यहाँ पे there are hostile factors जिसकी वजह से acidity और ulcer होता है. H.Pyroli, gastric acid, pepsin and NSAIDs. But ये हमेशा से present है. But it is always balanced by the protective factors like bicarbonate, prostaglandin, mucus production and blood flow to the mucosa. When this balance is disturbed, that is the hostile factors increases, then the protective factors, you get gastric ulcer. Gastric ulcer is a combination of both. Remember, जब आपके balance between the hostile and the protective factor is disturbed. Whereas in hormonal factor आपने देखा था कि it was because of various individual factors like vagus nerve stimulation, gastrinoma and etc. There are some specific condition antacids ulcer के chapter में यहाँ पे H. pylori infection and NSAID कैसे काम करते हैं in case of ulcer, जो आपको याद रखना है. H. pylori infection is of great importance because we have seen H. pylori infection could be as severe as gastric carcinoma. उसके लिए we will see the mechanism of it, how it can causes. There are various mechanisms. It is very important in GPAT point of view. सबसे पहले तो H. pylori is a etiologic factor and could cause peptic ulcer and may predispose to gastric carcinoma. This bacteria colonizes the human stomach and it has following mechanisms जिसकी वजह से it can be either one or a combination of two or all the three together, जहाँ पे it could cause gastric ulcer. The first one is that H. pylori secretes urease. Urease generates ammonia. Ammonia की वजह से the pH of the stomach increases, which our body doesn't want. Okay, so in order to reduce the pH again and in order to neutralize this ammonia, body increases the acid production. Then it produces proteases which break down the glycoproteins which are very important in gastric mucus, जो आपके protecting factors में आते हैं. तो H. pylori की जो protease enzyme है वो उसको break कर देते हैं, जिसकी वजह से there is decrease in the mucus defense. And then phospholipases जिससे phospholipids break down हो जाते हैं. The second mechanism is bacterial lipopolysaccharide attracts the inflammatory cells to the mucosa and chronically inflamed mucosa are susceptible to injury. हमने definition of an ulcer में पढ़ा था, it is inflammation with a damage. So damage तो ये proteases and lipopolysaccharides and increase acid कर रहे हैं mucosa को, but the inflammation is because of attraction of inflammatory cells towards the bacterial lipopolysaccharide जो बैक्टीरिया के स्ट्रक्चर पे प्रेजेंट है, and because of this the chronically inflamed mucosa are very susceptible to injury. And last, a bacterial platelet activating factor promotes thrombotic occlusion of the surface capillaries. हमने how to take care of the gastric ulcer में पढ़ा था, increase the blood supply. Okay, so बैक्टीरिया का जो प्लेटलेट एक्टिवेटिंग फैक्टर है विच इज नेचुरली जिसका रोल होता है ब्लड क्लॉटिंग, तो इट कुड क्लॉट अ ब्लड वेयर इट इज रिक्वायर्ड, बट यहाँ पे इट प्रमोट्स द थ्रोम्बोटिक ऑक्लूजन. थ्रोम्बोटिक ऑक्लूजन मींस थ्रोम्बस, अ ब्लॉकेज of the surface capillary जो supply कर रहे हैं nutrients and blood towards the gastric mucosa. So because of which the blood flow decreases and hence there could be cell death, there could be reduce renewal और repair का जो हमने बात किया था वो कम हो जाएगा. And because of all these contributing factor, H. pylori is of great importance or rather a great villain in case of पेप्टिक अल्सर, जहाँ पे ये तीन मैकेनिज्म्स हैं आपको याद करने हैं. Either one of it could be MCQ or it could be like which of the following is the mechanism of H. pylori infection causing peptic ulcer, A, B, C, D. If D is all of the above, then all of the above is correct. We come to the previous slide. Next we come to the NSAIDS induced gastric ulcers. NSAIDS initiate the mucosal injury topically by their acidic properties, and then systemically they play a prominent role by decreasing the synthesis of mucosal prostaglandins. The precursor of prostaglandin, that is arachidonic acid, is catalyzed by two cyclooxygenases, COX-1 and COX-2 enzyme. मतलब arachidonic acid is converted into prostaglandin via COX-1 and COX-2 enzymes. The anti-inflammatory property of NSAID is mediated to the inhibition of COX-2 enzyme. Okay. सो COX-2 एंजाइम की वजह से एंटी इंफ्लेमेटरी प्रॉपर्टी विच इज डिजायरेबल वो तो अचीव हो जाती है, बट remember that this COX-2 enzyme is also involved in prostaglandin production, and prostaglandin is the one which is a protective factor in gastric mucosa. prostaglandin की वजह से mucus बनता है which protects your gastric mucosa. So it inhibits the prostaglandin production as well, which is the undesirable effect of NSAIDs and which causes gastric and duodenal ulceration. So how do we tackle all this? First, you have to take care of the H. pylori infection. Then increase the acid secretion. Increase gastric acid secretion को कम करना है आपको. ड्रग्स का ख्याल रखना पड़ेगा लाइक NSAIDs, एस्पिरिन, कॉर्टिसोन. सिगरेट स्मोकिंग सेसेशन इज वेरी इंपॉर्टेंट. अल्कोहलिज्म को कम करना पड़ेगा. And how do you achieve all this is by take the help of mucosal defense mechanism. That is आपके prostaglandins which are involved in the mucosal defense, आपको उसको increase करना पड़ेगा. Then the natural buffer bicarbonate, उसका secretion आपको increase करना पड़ेगा. Then a tight adherence between the epithelial cells to prevent any acid leakage inside the cells. That is cell junction को आपको tight करना पड़ेगा. You have to increase the blood flow to the mucosa because mucosa को जब blood flow increase होगा उसका repair, wear and tear increase हो जाएगा. So even there is a lot of acid, let the mucosa be damaged. अगर वो repair बराबर हो रहा है owing to the good blood flow, you can tackle the problem of acidity. Then you have to renew the damaged epithelial cells. So this is how आपका classification भी बनाया गया है, जहाँ पे there are drugs to reduce the acid secretion, there are drugs to neutralize the acid that is already present. Then we said something about you have to regenerate and renew the cells which are damaged. So there are ulcer protectives and ulcer healing. And then H. pylori was the biggest villain जहाँ पे आपको काम करना था. So H. pylori, anti-H. pylori drug, there are classical amox and clarithromycin type of antibiotics जो patients को दिए जाते हैं in clinical practice. So in case of gastric acid secretion, जैसा हमने mechanism में देखा था, H2 blocker are antihistaminics. Example include cimetidine, ranitidine, famotidine, and many TDs. Then ultimate step, the proton, जो H plus Cl में से जो H हमको supply कर रहा है, that is a proton, उसके pump को inhibit करना. There are classical drugs like omeprazole, esomeprazoles, and they are known as the PPI, proton pump inhibitors. Anticholinergic agents are also used like pyrazipine, propanthyline and oxyphonium. Then direct prostaglandin analog like misoprostol is used. Prostaglandin analog जहाँ पे हमने बात की थी the mucosal defense की. So prostaglandins का production increase करना is a bit difficult, but direct ready-made prostaglandin analog you can give. Example of which is misoprostol. Then whatever acid is there, you have to neutralize it. So there are two types of acid neutralizer. One is systemic and one is non-systemic. Systemic is the one which get absorbed into your blood circulation, and non-systemic is the one which do not get absorbed but remains local to the gastric cavity. वो आपके स्टमक के अंदर ही रहता है. Systemic में sodium bicarbonate and sodium citrate, and non-systemic you have various magnesium and aluminium salts. Ulcer protectives में they form a protective cover over the ulcer. They are sucralfate and colloidal bismuth substrate (CBS). Ulcer healing में carbenoxolone sodium, एंड एंटी एच पाइलोरी ड्रग्स में अमोक्सिसिलिन, क्लेरिथ्रोमाइसिन, मेट्रोनिडाजोल, टीनाजोल एंड टेट्रासाइक्लिन्स. नाउ वी कम टू H2 एंटागोनिस्ट. यहाँ पे हमने इंडिविजुअल क्लास उसके मैकेनिज्म ऑफ एक्शन प्रीवियस वीडियो में हमने देख चुके हैं. सो इस वीडियो में हम ईच एंड एवरी क्लास लेंगे, बट उसके सिर्फ जो क्रक्स इम्पॉर्टेंट जीपैट रिलेटेड पॉइंट्स है उसी पे ध्यान देंगे. इन केस ऑफ H2 एंटागोनिस्ट जो आपको याद रखना है वो है सिमेटिडिन, ranitidine. These are various tidines which come under H2 blocker. जिसमें से सिमेटिडिन has the problem of gynecomastia, loss of libido, anti-androgenic property, and it also causes a transient elevation of plasma aminotransferases. So ये साइड इफेक्ट जो है एंटी एंड्रोजेनिक साइड इफेक्ट है. दिस इज स्पेसिफिक टू सिमेटिडिन, hence it can be a GPAT MCQ. एंड ये किसी और क्लास ऑफ कंपाउंड में नहीं देखे जाते हैं इन केस ऑफ एंटी अल्सर जब आप पढ़ रहे हैं. सो रिमेंबर दिस पॉइंट. देन एंटी एंड्रोजेनिक प्रॉपर्टी इज सीन इन केस ऑफ सिमेटिडिन. फिर आते हैं हम रानिटिडीन पे. इसमें देयर इज नो एंटी एंड्रोजेनिक प्रॉपर्टी, नो प्रॉब्लम ऑफ male sexual dysfunction or gynecomastia, so hence a safer compound. Then famotidine में you have seen because of higher potency, longer duration of action, it has been considered as most suitable for two things: Zollinger-Ellison syndrome and aspiration pneumonia. So specific to a particular disease, anti-ulcer में आप ड्रग जो पढ़ रहे हैं that is famotidine, classically indicated for ZNE disease and aspiration pneumonia. Next is the proton pump inhibitors, the PPI. इसमें omeprazole, lansoprazole, esomeprazole थे. So omeprazole का S enantiomer is S-omeprazole, जिसको हम ES omeprazole करके लिखते हैं. तो what is the benefiting factor over S-omeprazole of S-omeprazole is that it is claimed to have a higher oral bioavailability and it produces a better control of intragastric pH than omeprazole, and it is indicated in GERD, gastroesophageal reflux disease patients because of slower elimination and a longer T-half. ये सारे पॉइंट्स जो है could be a GPAT MCQ, जहाँ पे आपको पूछा जा सकता है कि how is esomeprazole better than omeprazole. So 1, it has higher oral bioavailability. Second, it produces a better control on intragastric pH. Then it has a slower elimination, and fourth, it has a longer T-half. Then we come to pantoprazole, where it is used in bleeding patients, जहाँ पे blood is seen in ulcerative patches, उस जगह पे pantoprazole use किया जाता है. And it is also used in the prophylaxis of acute stress ulcers. इसका enantiomer S-pantoprazole. इसमें आपको याद रखना है कि जब ये इनैंशियोमरिक फॉर्म जो है इसके, अगर वो मिक्स करके दिए जाएंगे, रेसिमेट मिक्सचर के फॉर्म में दिए जाएंगे, तो उसकी पोटेंसी हाफ रहेगी. व्हेन दे आर गिवन एज सिंगल इनैंशियोमर, इट इज ट्वाइस पोटेंट. सो दिस कुड बी अ GPAT MCQ, जहाँ पे रेसिमिक मिक्सचर इज हाफ पोटेंट एज दैट ऑफ इंडिविजुअल enantiomeric form. Then the last we come to rabiprazole, which has the fastest acid suppression. Sorry for the spelling error, it's suppression. So rabiprazole has the fastest acid suppression. ये भी एक GPAT MCQ है जो आपको याद रखना है. Then we come to the antacid. Antacid में एक टर्म है जो आप लोगों को ध्यान रखना पड़ेगा, विच इज एसिड न्यूट्रलाइजिंग कैपेसिटी, जिसके बेसिस पे एंटासिड्स कैरेक्टराइज किए जाते हैं, जिनके बेसिस पे एंटासिड की पोटेंसी जज की जाती है. सो व्हाट इज इट? The potency of an antacid is generally expressed in terms of its acid neutralizing capacity, which is defined as the number of milliequivalents of one normal HCl that are brought to a pH of 3.5 in 15 minutes or 60 minutes in some tests by a unit dose of antacid preparation. So, when you titrate the antacid with the hydrochloric acid, so the number of milliequivalents of one normal HCl is brought to a pH of 3.5 in 15 minutes or 60 minutes by a unit dose, whatever be the unit dose that is given at a time of antacid, 5 mg, 10 mg, whatever that is set to the antacid preparation. So this is the acid neutralizing capacity. You have to remember this. This could be a GPAT MCU. This could also be useful, very useful in your theory exams as well. जहाँ पे MCQ में they will shuffle you with the milli equivalent. यहाँ पे कुछ और दे सकते हैं, millimolar दे सकते हैं, nanomolar दे सकते हैं. One normal HCl is important, one molar भी दे सकते हैं. And pH आपको remember करना पड़ेगा 3.5 है. And there are two timeline, 15 और 60 minutes. Antacids में हमने देखा था there are two types of antacids, systemic antacid and non-systemic antacid. There is a reason, specific reason दोनों को कब कहाँ यूज किया जाता है. तो जो systemic antacid होते हैं they are absorbed systemically, हमने बताया था blood stream में वो absorb होता है, but in large doses it will cause alkalosis. Alkalosis मतलब आपके blood का ही pH वो कम कर देगा, which is not desirable. हमको pH बढ़ा देगा in case of alkalosis, which is not desirable because we need action in the stomach. वहाँ पे acidity है, वहाँ पे the pH is reduced, not in the body or in the plasma. So this is undesirable, systemic alkalosis. Then it produces carbon dioxide in the stomach. Carbon dioxide in the stomach, which is the gas जो हम normal lay language में use करते हैं. This causes distension, discomfort, belching, and risk of ulcer perforations also. Then acid rebound can occur, but it usually short lasting. So there is rebound increase in the acid also when you use systemic antacid. And finally it increases the sodium load, which may worsen in case of edema and congestive heart failure. So because of 4 shortcomings of systemic antacid, we have used non-systemic antacids or locally acting antacids, which were magnesium hydroxide, aluminium hydroxide. जहाँ पे ये 4 ड्रॉबैक्स आप लोगों को याद रखने हैं, which could be a GPAT MCQ, जहाँ पे एक कॉम्बिनेशन करके दिया जा सकता है कि it is absorbed systemically and in large doses it causes alkalosis. True or false type के MCQ भी यहाँ बन सकते हैं, जहाँ पे you should know it causes alkalosis and not acidosis. So remember these 4 points very carefully. So with this we end the pharmacology of anti-ulcer drug. Thank you.